Hi everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, we're taking a closer look at Opzelura, the first and only topical JAK inhibitor approved for both atopic dermatitis and vitiligo, providing target relief right at the skin level. If you watched my earlier video on Eczema, another topical JAK inhibitor approved for chronic hand eczema, you'll remember it's designed specifically for the hands. Opzelura, by contrast, is approved for atopic dermatitis, which often affects larger or multiple body areas, making it a better fit when disease is more widespread. Most recently, in September 2025, Opzelura's atopic dermatitis indication was expanded to include children as young as 2 years old, giving physicians another valuable option for pediatric eczema management. In this episode, we'll focus on Opzelura in atopic dermatitis, covering 5 key things you should know: its indication, how it works, how to use it, important warnings and precautions, and side effects and safety. And if you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Opzelura and who it's for? Opzelura, or Ruxolitinib Cream, is a topical JAK inhibitor approved by the FDA for 2 skin diseases: atopic dermatitis and non-segmental vitiligo. Opzelura was first approved in September 2021 for the short-term and non-continuous chronic treatment of mild to moderate atopic dermatitis in non-immunocompromised adults and adolescents 12 years and older whose disease is not adequately controlled with other topical prescription therapies, or when those therapies are not advisable. After results from additional pediatric pivotal trials, the approval was extended in September 2025 to patients as young as 2 years old, marking an important step forward in treating eczema across all age groups. For vitiligo, Opzelura was approved in July 2022 for adults and adolescents 12 years and older to help restore pigmentation in affected skin. Unlike oral JAK inhibitors that circulate throughout the body, Opzelura acts locally, providing targeted immune modulation where inflammation persists. It offers an effective, steroid-free option for patients seeking relief from the itch, redness, and scaly skin associated with atopic dermatitis. Second, how does Opzelura work? To understand that, let's take atopic dermatitis as an example. Atopic dermatitis is a chronic inflammatory skin disease driven by a dysregulated immune response that causes itch, inflammation, and skin barrier damage. Key cytokines, especially IL-4, IL-13, and IL-31, remain overactive, keeping itch and inflammatory signals turned on. These cytokines communicate through the JAK-STAT pathway, an internal signaling system that helps immune cells transmit messages. When JAK enzymes activate STAT proteins, genes that drive inflammation and itch are switched on. Opzelura contains ruxolitinib, a selective JAK1 and JAK2 inhibitor that blocks this signaling cascade. By inhibiting these enzymes, Opzelura interrupts overactive cytokine activity, helping to calm inflammation and reduce itch. In simpler terms, JAKs are the switches for inflammation. When they stay on, skin keeps flaring. Opzelura helps turn those switches off, regaining disease control and improve skin health. Because it's applied topically, its effect is localized with limited systemic absorption. Third, let's talk about how to apply Opzelura. Opzelura is for topical use only. Do not apply it in the eyes, mouth, or other mucous membranes. For atopic dermatitis, apply a thin layer twice daily to affected areas of up to 20% of body surface area. To estimate body surface area, one hand print, just one hand, not both sides, represents roughly 1% of total body surface area. So the total area treated should not exceed about 20 of the patient's own handprints. A common mistake, especially in children, is using the caregiver's hand to measure. Remember, the 1% rule is based on the patient's hand size, not the caregiver's. The cream can be used on most areas of the body, including sensitive regions such as the face, neck, or skin folds. However, avoiding using Opzelura under occlusive dressings, such as tight bandages that cover and seal the skin, which can increase drug absorption. Those limits also apply. For adults and adolescents 12 years and older, do not use more than one 60-gram tube per week or one 100-gram tube every 2 weeks. For children 2 to 11 years old, the limit is one 60-gram tube every 2 weeks. Once signs and symptoms of atopic dermatitis, such as itch, redness, and rash, resolve, treatment should be stopped. If there's no improvement after 8 weeks, reassess with the healthcare provider. For non-segmental vitiligo, apply twice daily to affected areas of up to 10% of body surface area, following the same tube limits as for atopic dermatitis in patients 12 years and older. Satisfactory clinical response may require more than 24 weeks of therapy. If meaningful improvement hasn't occurred by 24 weeks, reevaluate with the doctor. Avoid concomitant use of Opzelura with strong CYP3A4 inhibitors, which may increase systemic drug exposure. Wash hands after applying Opzelura unless the hands are being treated. If someone else applies the cream, they should wash their hands afterwards. Fourth, let's review the warnings and precautions for Opzelura. Like other JAK inhibitors, Opzelura carries safety considerations informed by experience with oral JAK inhibitors used for other inflammatory diseases. Although systemic absorption is much lower with topical use, the risk, while very low, is not zero. First, serious infection may occur, including bacterial, viral, and fungal infections. In long-term studies with Opzelura, serious infections were rare, about 0.2 cases per 100 patient years, or roughly 2 per 1,000 people treated for a year. Herpes zoster or shingles was also uncommon, occurring in about 1 case per 100 patient years, which is around 1% of patients treated for a year. If shingles develops, stop Opzelura temporarily until the episode resolves. Do not use Opzelura in patients with active serious infections. Before starting treatment, discuss risk and benefits with a healthcare provider, especially if there's a history of chronic or recurrent infections, prior serious infections, recent exposure to TB, residence or travel in regions where TB or fungal infections are common, or if the patient has diabetes, chronic lung disease, HIV, or a weak immune system. Monitor for signs and symptoms of infection during and after treatment. If a serious infection or sepsis occurs, pause Opzelura and do not resume until the infection is fully controlled. Second, malignancies, including lymphoma and lung cancer, have been reported with oral JAK inhibitors, with higher risk in current or past smokers. Healthcare providers should weigh risks and benefits before starting or continuing Opzelura, particularly in patients with a history of cancer or those who develop a malignancy during treatment, and in current or past smokers. With Opzelura, certain skin cancers, basal cell carcinoma, and squamous cell carcinoma have been reported. Patients should have periodic skin examinations and limit sunlight and UV exposure by wearing protective clothing and use broad-spectrum sunscreen. A higher rate of major cardiovascular events, heart attack, stroke, or cardiovascular death has been observed with oral JAK inhibitors in patients 50 years of age and older with at least one cardiovascular risk factor, with even higher risk in current or past smokers. Healthcare providers should evaluate cardiovascular risk before initiating and continuing Opzelura, consult patients on warning signs and symptoms during treatment, and discontinue Opzelura in anyone who has had a heart attack or stroke. Rare events of blood clots, including deep vein thrombosis and pulmonary embolism, have been reported with Opzelura. Avoid Opzelura in patients at high risk of blood clots if leg pain or swelling, sudden chest or back pain, or short of breath occurs while on treatment. Stop Opzelura and seek immediate medical care. Cytopenias, including low platelet, red blood cell, or white blood cell counts, have been observed with Opzelura. Healthcare providers may check blood counts if clinically indicated, and stop Opzelura if signs or symptoms of low blood cell counts happen. Tell your healthcare provider right away if you develop or have worsening any of these symptoms. Finally, increases in cholesterol and other lipid parameters have been reported with oral ruxolitinib. Patients with elevated lipids should discuss monitoring and cardiovascular risk management with their clinicians. And finally, let's talk about the side effects and safety of Opzelura. In atopic dermatitis trials, the most common side effects included nasopharyngitis, bronchitis, ear infection, hives, diarrhea, inflamed hair follicles, swelling of the tonsils, and runny nose. There were also laboratory findings involving certain white blood cells, such as increased eosinophils or decreased neutrophils. In children aged 2 to 11 years with atopic dermatitis, upper respiratory infections including COVID-19, application site reactions, fever, and decreases in white blood cells were somewhat more common. For vitiligo, frequent side effects include application site acne, itching and redness, nasopharyngitis, headache, urinary tract infection, and fever. Overall, most side effects were in small percentages, and few patients discontinued treatment due to adverse events in the clinical trials. However, there's still a couple of things to be noted. Patients should avoid using Opzelura together with biologic therapies, other JAK inhibitors, or potent immunosuppressants, such as azathioprine or cyclosporine. If you're pregnant or planning pregnancy, discuss with your doctor. It is not known if Opzelura can harm an unborn baby. Breastfeeding is not recommended during treatment and for at least 4 weeks after the last dose. Overall, Opzelura has a well-defined safety and tolerability profile. With appropriate monitoring and use within the suggested dosing limits, it can be applied safely as a short-term and non-continuous therapy for atopic dermatitis. And there you have it, 5 key facts about Opzelura, the topical JAK inhibitor approved for both atopic dermatitis and vitiligo. For patients and families dealing with refractory, intractable skin disease, Opzelura offers a potent, steroid-free option with minimal systemic exposure and targeted action at the skin. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experience in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.